Right, ladies and gentlemen, the topics for today's discussion is papillary thyroid carcinoma. Now, this is a very important topic because papillary thyroid carcinomas are common among the most common, the commonest actually amongst the different varieties of thyroid cancers. Now, in an OSPE, you may be asked any of the thyroid cancers, but this is the one that is most likely to be asked. I have seen questions in which other forms of carcinomas, follicular, even medullary, anaplastic, have been asked. I'm sorry, but remember that papillary thyroid carcinomas are the commonest ones. Now, how they usually present? They usually present as asymptomatic nodules. Asymptomatic in the sense that they may not cause any symptoms of hypo or hyperthyroidism, but what the patient tells you is that there's a enlargement in the neck, there's a swelling in the neck, and with clinical examination, following the clinical examination protocols, you assess the patient and you make a conclusion that this is a thyroid swelling. Then you perform different thyroid scans, etc., and then you know that it's most likely a thyroid swelling, the and probably a neoplasm. Now, how you know that? They generally represent as a cold nodule. Now, cold nodules are usually tumorous, not necessarily, but usually they have a higher likelihood of being a tumor nodule. Now, on gross inspection, uh, this is one gross picture of a papillary thyroid carcinoma. This lesion is single, but remember that they can present as multifocal nodules. So, somebody may mention in a scenario that there is a single nodule, somebody might mention that there are multiple nodules. It may be infiltrating into the surrounding thyroid tissue. It may sometimes be um, circumscribed and even encapsulated as well. So this is the typical picture. These are the structures which are known as papillae, and here's how it derives its name, this tumor, papillary thyroid carcinoma. So papillae are the main feature. First main feature we'll discuss about in this picture that is given in your textbooks is visible on gross inspection as well. You can see here, if you follow the cursor, these small tiny excrescences, these are termed the papillae. Now here is one papillae as well. These are the larger ones, and this is the smaller one. This is the larger one, this is the larger one. So this a particular example is encapsulated as well. So if you look closely, you follow the cursor, the encapsulation is visible as well, and this one is not pretty much circumscribed because you can see it is just kind of bulging out of the surface on cut section, but if you see it from the outside, it may appear circumscribed as well. But generally remember, if somebody is asking about presentation, usually they are ill-defined, single, maybe multiple. I've seen a lot of multifocal examples as well. I've seen unifocal examples as well, so it varies a lot. Now, talking about the histological features of this tumor. Now we said the first histological picture is indicated by the name papillae. Now you've seen papillae in another tumor as well. If you remember, papillary urothelial carcinoma. We talked about papillae in detail there as well. Now here, kindly follow the cursor. You see this is a papilla, okay, and why we say that there's in the center there is a fibrovascular core. This is a very fine vessel that is running in between. This is another vessel that is running in between. This is another vessel, and around this vessel there are multiple cuboidal cells which have particular nuclear features. We'll talk about nuclear features shortly. Now remember, if you try to concentrate on this particular papilla in the center, now there is a vessel in the center, okay, fibrovascular, there is some degree of fibrosis as well, and there are cuboidal cells which are kind of overlapping each other. So here we come to another feature of papillary thyroid carcinoma, that is the cells appear to overlap each other, they are crowded together. You see one cell over another. Now if you look closely, other features of papillary thyroid carcinoma get visible. Now if we concentrate on one cell, for example this one, you see another feature. The central nucleus appears to be kind of empty in the center. This white area appears to be empty, so this is termed as nuclear clearing. This is a very important feature of thyroid cancers, nuclear clearing. Somebody would mention a ground glass nucleus, somebody would mention it as an orphan and nucleus, but these are different names for the same thing. The main thing is that the nuclei appear clear, there's optical clearing. So there's another important feature, and the next important feature is that the nuclei show some grooves. If you follow this fine line that is running in between, this is a nuclear groove. So we have papillae, we have nuclei or cells that are crowded together, so and they which appear to overlap. Then we have nuclear clearing, then we have grooving, and then we come to another feature of these cancers and that is Samoma bodies. Samoma bodies are usually found in papillary thyroid carcinomas. You see one example of a Samoma body here. The cursor is pointing it right now. These kind of appear eosinophilic to basophilic rounded bodies. This is not exactly a Samoma body, but I'd like you to pay attention to it because a typical Samoma body would be more rounded in shape, and these appear kind of basophilic to eosinophilic structures. You can see the examples in other pictures as well. You can find them on the internet. So Samoma bodies, another feature, and then we come to another to the last feature, last important feature of papillary thyroid carcinomas, and that is the nuclear pseudo-inclusions. You'll find the word pseudo-inclusions in your books. Now why the okay, first we look at pseudo-inclusion. This particular picture is a photomicrograph of cytology, not histology, but this is given in your textbooks. This is a nuclear pseudo-inclusion. This is a pseudo-inclusion. Why we call them pseudo-inclusions? That these are actually invaginations of the cytoplasm and not the nucleus itself, so they're termed as pseudo-inclusions. Okay, so if we revise a bit: papillae, fibrovascular cores, then overlapping nuclei, nuclear clearing, grooving, crowding, Samoma bodies, and pseudo-inclusions are the main features of a papillary thyroid cancer. Talking about histology. So that is it for now. I hope you've registered some of the points of papillary thyroid carcinomas. Thanks a lot.